Good morning. Good morning, sir, for allowing me to present my small presentation. This is very unusual topic. Everybody knows about the pseudo accommodation or accommodation in pseudophakic eyes where implanted with the non-accommodative lenses. Now, the ability to see near vision with distant corrected glasses in eyes with monofocal lens. This is what we know, that is pseudo accommodation. It is also known as pseudophakic accommodation. Then the diopter measured is called amplitude of accommodation. Now there are two, dynamic and static. The dynamic where the ciliary muscles function, but is doubtful once the cataract is removed. But there are some other important factors like corneal multifocality, spherical aberration, chromatic aberration, pupil size, residual refractive error, and of course IOL designs and properties. If the lens has a multifocal focal points, means it's a spherical lens, it has a more depth of focus, gives better near vision. And if aspheric surface with the blue light filtering properties also can reduce amplitude of accommodation. Because of this cataract surgery, the central cornea remains same, but the peripheral cornea it little gets more curved, and there is corneal multifocality that can also help in pseudoaccommodation. Pupil size, when it is small, it is found in the studies, then it has a large depth of focus. Then when it is 2.5 millimeter, it has 0.75 diopter. It is more depth of focus. What we did in this study, we knew that these patients sometimes they can read up to N12 and 18 when they are with the distant corrected glasses. But then what we did, we corrected their vision or distant vision. Then with the distant vision glasses in the trial frame, holding the charge at the same level, we went on adding 0.5 diopter plus for the near vision till their vision was achieved N6. So that diopter which was required to get this was noted down. And then we continued adding 0.5 half diopter till it maintained N6. So difference between the first, we presume that is 2.5 or 3 is a normal diopter required for the near vision. But then the diopter required to correct N6 was the pseudo accommodation, and which maintained it was amplitude of accommodation. In these 45 eyes, different lenses were implanted, monofocal, foldable, non-foldable. This is the age group between 50 to 70. And we found that in higher age group, the accommodation of above 70, the accommodation was less. Clear versus light filtering, India, the IOLs, Indian versus imported, foldable versus rigid, aspheric versus spheric, we did not find significant difference in the pseudo accommodation. However, with the pupil size, when it was less than up to 2.5, it was maximum 1.19 diopter, and with more than 3.5, it was less. So average pseudo accommodation, what is the discussion? Oh. Anyway, the pseudo accommodation we found was +1. The pseudo accommodation is a reality. It gives you better distant and near vision without correcting glasses in monofocal IOLs. The depth of focus, corneal multifocality, age, foldable versus rigid, they do not influence much on the pseudo accommodation. But the pupil size is probably the most important factor. Some cases when we found with the low myopia plus astigmatism, they did not need any glasses. And to update, we have more than 150 cases in this study, and almost the results are same. The pupillary diameter, it really works. And when we did this study, by putting plus half diopter with the distant glasses, the patients really were putting some strain to achieve the N6. And then normally, we fall it is plus 2.5 or 3. So that difference is really a pseudo accommodation. And till it continued up to N6, plus 3, plus 3.5, this is the amplitude. Thank you very much, sir.